Hello everyone. Today's topic is about the pandemic that has shaken the world and is creating a moment of terror in each household. This video is especially important for India, where the spike rate in the death cases is quite steep and is expected to grow exponentially. So without wasting time, let's start the video about compulsory licensing. Before we start to understand what compulsory licensing is, it is very important to understand the two terminologies we will be using. They are patented products and generic products. Under the Patents Act 1970, under normal circumstances, a person or a company invests his time and money to conduct research and create new innovative product which is for the betterment of the society as a whole. And to reward that company, who is also called a patentee, he is given the legal protection for 20 years to restrict others from using his technology. So technically, he is given a monopoly for 20 years to reap benefits out of it. So the obvious question is, why 20 years? This is the period as mentioned in the Act, and globally the period remains invariably the same. It is a type of barter system where the innovator or the patentee reveals the process of manufacturing the product and he is given a 20 years to commercialize or monopolize it. The patentee can issue licenses to other people at his own terms and conditions. But what after 20 years? After the completion of 20 years, the patent ceases to exist and cannot be renewed. Now anyone can manufacture the product and the prices drop down as multiple players enter into the market. This type of product is called generic product. Now after we have briefly discussed what a patented and a generic product is, let us talk about our main topic, that is compulsory licensing. I feel it is the need of the hour and will greatly reduce the financial and mental pressure the world is facing currently. According to the Patents Act 1970, there is a section 92, Clause A, Subclause 1, which specifically talks about the situation the world is currently facing. The Act says, compulsory license shall be available for manufacture and export of patented pharmaceutical products to any country having insufficient or no manufacturing capacity in the pharmaceutical sector for the concerned product to address public health problems, provided compulsory license has been granted by such country or such country has, by notification or otherwise, allowed importation of the patented pharmaceutical products from India. The detailed act is mentioned in the description box. Now let us see whether we have any precedent of compulsory licensing in India or not. The answer to the question is yes, it has been used, but just once in 2012. In India, the first compulsory license which was granted by Patent Office was in 2012 to Natco Pharma, an Indian company for generic production of German-based Bayer Corporation's drug Remdesivir. The drug was used for treatment of liver and kidney cancer. This is a very well-known example of compulsory license. The drug, which was sold for Rs 2,84,428 for 1 month's dosage, was made available at Rs 8,880 for a month's dosage by Natco Pharma, and this includes the 6% royalty paid by Natco to Bayer Corporation. So here we can see the prices dropping down drastically using compulsory licensing. After all this, I feel it's high time that compulsory licensing should be invoked under the Patents Act 1970. There are several manufacturing companies in India who are capable enough to make the vaccines and COVID medicines like Remdesivir and Tocilizumab in India for Indians and for the rest of the world. In this case, the price of the medicine is of less concern, but the availability is more important. With this, I would like to urge the government to invoke Section 92A of the Patents Act so that precious lives can be saved. The talks of compulsory licensing are already doing the rounds. I think it's time we act with utmost urgency. All those who feel that compulsory licensing is the solution to this problem, please post your messages. Thank you.